Thanks, everyone. Welcome to the sector brief for CareFinder Program Request for Proposal. My name's Hope McMahon. I'm the Program Manager for Older Persons Health. I'd like to acknowledge the Ngunnawal people, the traditional custodians of the land on which we're meeting today, as well as other people and families with connections to the lands of the ACT and surrounding region. We acknowledge and thank our First Nations communities for their ongoing contributions to the vibrant life and culture of Canberra and pay our respects to their elders past, present and emerging. We also extend that respect to the traditional custodians of other lands that you may be attending this meeting from, as well as all Aboriginal and Torres Strait Islander people here today. Finally, we recognise that sovereignty was never ceded. This always was and always will be Aboriginal land. I acknowledge that the CareFinder program also works closely with people with lived or living experience of mental ill health, and I believe that it is also important to acknowledge the individual and collective experience of those with lived or living experience of mental ill health and suicide, and the experience of their carers, families and supporters. We value and respect the generous and vital contributions of those who share their unique perspectives to guide us to shape an effective and connected primary healthcare system that supports better outcomes for all. I'd like to introduce you to the CHM team members who are involved in Older Persons Health Portfolio and the CareFinder program. Some of the team are here today supporting this brief, and I'll ask them to introduce themselves as we go through. So I'm Hope. Our executive who leads us is Anais Legal, our General Manager, Health System Improvement, Mamta Paral, Senior Manager, Health System Integration. I'd also like to introduce Rachel Baker. CareFinder program sits with our service relationship team, and Rachel is here today. Rachel, would you mind just saying hello?
Morning, everybody. Nice to be here.
Thanks, Rachel. And then we also have Jess Hewson, is a service relationship coordinator working with the CareFinder program. Jess, would you like to introduce yourself?
Good morning. I'm Jess from Capital Health Network.
Thank you. Supporting this RFP, we also have Sharon Storen, who's our contracts coordinator, and Kanal Mahite, who is behind the scenes today helping us with the tech support. Thank you. Kanal, would you like to say hi?
Good morning, everyone. Thank you for joining.
So just a brief session overview. So we'll go through the process and some housekeeping. I'll introduce you to Capital Health Network, which I'll refer to as CHN, the request for a proposal, which is why you're all here today, the overview, some documents to assist your application, the procurement and establishment timeline, and then we'll have some time for questions at the end. The brief is covering, as we say, CHN's request for proposals to deliver the CareFinder program. This brief will provide a high-level detail of the RFP along with information on the lessons learned from commissioning CareFinder since 2023 from a local and national perspective. Just some housekeeping before we move on. Please make sure your microphone is muted. The session is being recorded and will be available for viewing via CHN's YouTube channel, and a link will be added to this RFP's webpage. If you are not comfortable with the session being recorded, please remember to turn off your camera. Alternatively, please log out and watch the recording. We will provide some time at the end to answer questions for you all. If you do have any questions, please enter them into the chat. This will help us keep track of questions we've answered, and the team will endeavour to answer your questions, as many as we can. But we thank you for your patience if we do need to take any questions on notice. So, Capital Health Network is the primary health network for the ACT. PHNs have been established by the Australian Government with the key objectives of increasing the efficiency and effectiveness of health services for patients, particularly those at risk of poor health outcomes, and improving coordination of care to ensure patients receive the right care at the right place at the right time. CHN seeks to meet these aims across 9 priority areas. care across the continuum, digital health, First Nations health, mental health, alcohol and other drugs, chronic conditions, at-risk populations, older adults' health, and workforce. This request for proposal seeks proposals from community and support organisations and other healthcare providers to work collaboratively with CHN in the delivery of the Care Finder program in the ACT region. CHN will establish and maintain a network of Care Finder to provide specialist and intensive assistance to help people within the Care Finder target population to understand and access aged care and connect with other relevant supports in the community. The Care Finder program will ensure provision of services that support engagement of older Australians within the aged care system, assist them with aged care service navigation, access and connection and other relevant community support so that their needs are more holistically met. The Care Finder network will address the specific local needs of the region in relation to Care Finder support, be an integrated part of the local aged care system, collect data and information to support an evaluation of the Care Finder program, support and promote continuous improvement of the Care Finder program, support improved integration between the health, aged care and other systems at the local level within the context of the Care Finder program. So program outcomes, I won't read through the program outcomes in detail, but I wanted to take the opportunity to draw your attention to the Care Finder policy guidance, which providers are required to follow for the delivery of the Care Finder program. So these program outcomes listed on the screen are taken from the Care Finder policy guidance. I'd also like to draw your attention to some other important information within the RFP. We have the target group listed on page 4, funding and budget information from page 7, services required from page 8, and reporting requirements from page 9. We anticipate that this information would be read in the context of the Care Finder policy guidance and should provide clarity on what is expected for providing this service in the RFP. Of course, questions are welcome if required. All Care Finders, so training and supervision requirements. All Care Finders and their managers and triage staff will be required to complete mandatory online induction training regardless of prior training or experience. The induction training package developed by Department of Health, Disability and Ageing, will cover key foundational information for the Care Finder role and competencies. Client-facing staff will also be required to have completed training in cultural safety and trauma-informed care, and provision of support to Care Finder staff, that is via clinical supervision or counselling to support wellbeing and reduce the risk of burnout is required. This is the second funding cycle for the Care Finder program. Since 2023, there have been 5 commissioned Care Finder providers delivering services in the ACT. As of the end of March 2025, a total of 601 people had been supported by the program, including 198 active cases. In combination with the CODA Australia-led Aged Care Navigator trial funded by the Department of Health, Disability and Ageing, the last 2.5 years commissioning Care Finder locally and nationally have provided an opportunity to understand many of the characteristics that contribute to safe and effective Care Finder services. We will incorporate the lessons learned into future activities. So we'd like to go through some of those lessons learned with you today. Firstly, I'm sure this comes as no surprise to any of you who are familiar with the program. The Care Finder role is complex. Staff burnout is a risk that must have appropriate controls in place. Regular supervision, both internal and external clinical supervision, is essential. Having more than one Care Finder on a team allows for more options when managing risks such as those related to home visits. Care Finders report high value in working as part of a team of Care Finders in terms of sharing expertise, debriefing and leave coverage. At an organisational level, a care finder team with multiple staff allows for improved continuity planning. Care finders often bring varied expertise to the role. Clients should be connected with the most appropriate care finder with consent. Processes should be established between care finder providers to enable this. Wait lists create a barrier to access the service for the target group. Skill sharing and information exchange between care finder providers support continuous improvement and capability building. And care finder providers working together to share real-time capacity and staffing profile can improve access to the program for the target group. Care finders working together on assertive outreach strategies improves awareness of the program and increases referrals for clients within the target group. And data integrity is improved when providers use software that allows for the data set to be recorded and collated within it. So moving on to the assessment criteria, I just wanted to take the opportunity to point out that the RFP response form is the appropriate way to capture your response and submit it. So any responses that are not submitted using the RFP response form will not be considered. So there are 6 questions to cover. There's also assurance and compliance requirements, risk management and respective mitigation strategies that apply, and there are more details on that in the RFP. Essentially, local service delivery model, the key objectives of those are listed there for you. Moving on to additional information to assist your application. All responses are expected to be within the stated word limit, and word limits beyond that limit will not be assessed. No more than a total of 3 A4 pages will be reviewed in addition to responses in this form, inclusive of budget, any models and structures, etc. So questions or requests for information must be submitted via the tenders@chnact.org.au email using the subject heading PAC092 RFP questions. If questions are submitted via the method above, we will make a Q&A document available on the CHN website on the RFP page, and we'll update that document at 4 p.m. every Tuesday and Thursday. Questions are open until 5 p.m. Wednesday, the 28th of May. Some additional information to assist your application. So the Care Finder policy guidance, the first report on the implementation of Care Finder program. So that is the report put together by the independent evaluator currently, AHA. And just to give you the heads up that we are expecting the final report to be available in May or June, and I encourage you to monitor the Department of Health, Disability and Ageing website Care Finder page in the case that that publication becomes available while this tender is still open. Then of course the Aged Care Royal Commissions, which have informed this program, and resources for care finders is on the CODA Australia page that relates to lessons learned through the Aged Care Navigator trial, which has informed the design of the Care Finder program. Dates to remember: end of period for questions, 5 p.m. Wednesday the 28th of May. Submissions close 5 p.m. Tuesday the 10th of June. So procurement and establishment timeline. So the contract period is the 1st of September this year, 2025, to the 30th of June, 2029. Contract negotiation phase is expected to be entered into during the period of the 23rd of July to the 30th of July, with a commencement date of the 1st of September 25. All contracted care finder organisations must be fully operational following an initial establishment period and the ability to work with existing providers for handovers from the 1st of October 2025. Full service delivery must be available for clients by no later than the 31st of October 2025. And where relevant, providers will need to work with any care finder organisations who are exiting the service to ensure service continuity to clients and a seamless transition for the community and sector. Continuing care finder providers should have no interruption to service delivery. So where relevant, excuse me, providers will need to work with any care finder organisations, as I said, to ensure a seamless transition, and continuing care finder providers should have no interruption to the service delivery. So we've come to the end of the presentation. So we're just, if anyone has any questions, please add your questions into the chat. Alternatively, questions or requests for information can be submitted by the tenders at chnact.org.au email address, as I said, using the subject heading PAC092 RFP, and you've got until 5 p.m. on Wednesday the 28th of May to submit those questions. Thank you.